and I'm one of the consultant pediatric pulmonologists working currently at American Hospital in Dubai. I'm also the director of pediatrics, and I'm also a sleep physician. So I have various roles, various hats during the day.
And what was it that motivated you to specialise in paediatric pulmonology, especially?
Okay, so I always wanted to do pediatrics because I just love kids.
Yeah.
Being with kids, I never feel like I'm actually at work because half of the time you can just have a genuine chat with them, what they like, what are they up to these days, what their favorite character. And so just being with kids makes me happy.
Yeah.
And recently, I had an opportunity where my daughter was actually shadowing me as part of her school project, and she loves kids as well, and she was genuinely interested to see that like how our interaction is going on, and she jumped in as well as a
Yeah.
part of interaction, and it was really fun.
Yes.
Now, in terms of pediatrics, when I was training in London, I got inspired by some of the pediatric pulmonologists over there. They asked me to attend some of the conferences, got involved in research, and that's how my journey started really. And I felt that that is the right mixture of doing some intervention stuff, providing them a long-term care. When they become acutely unwell, you get involved in their acute care on intensive care. So I felt it was giving me the right mixture of doing some research, some teaching, providing them a long-term care, hands-on experience as well.
Yeah.
So dealing with technology when you're doing the sleep studies, doing bronchoscopies,
Yes.
getting involved in theater. So I felt it was the right subspecialty for me.
Yes.
That's what I was looking for, and hence pediatric pulmonology.
Yeah. Yeah. It's very dynamic.
Yes.
Yeah, and I like what you mentioned as well. Like you have to obviously with what you do, it's about building long-term relationships because obviously you look after the children, don't you, as they grow up.
Correct.
And then obviously with the parents, you have to connect with the parents.
Absolutely. Right from their birth until they're 18, going to university, starting their work. And so they become part of your family, really.
Yes.
And it's really fun because every time they are going for holidays, they have some graduation, they have something to speak about. And
Yes.
always parents are saying that even on holidays, it was like, have you got this for Dr. Omendra? Have you got this? Are we going to do this? What am I going to say next in the appointment? So it's really fun.
Wow, I love that. Could you just tell us a bit more about the paediatric pulmonology conditions that you treat commonly at the American Hospital in Dubai?
Sure. So my daily practice would involve commonly treating cough of different kinds.
Yeah.
Pretty much any chronic cough when they're presenting and not being treated by a pediatrician, unable to treat, then they will present to me.
Yes.
And that could be as simple as asthma, which is not been managed properly, or it could be something more severe like bronchiectasis, which is scarring of the lungs, or sometimes some children might be born with other chronic conditions or life-limiting conditions like cystic fibrosis, which is rare, but we see them. But sometimes we will be involved in children who are born prematurely and they are being sent home on oxygen or on ventilators. And so we help the team to manage them, look after in the home scenario, home circumstances on what we call as long-term ventilation. Or sometimes they might get really nasty pneumonia and they develop complications. And with complications, we get involved. They might need a chest drain. They might need some help with ventilation, with breathing, and they end up on pediatric intensive care. So we will get involved. So it has kind of mixture of things.
Yeah.
But also as part of my job as pediatric pulmonologist, I run the sleep lab. And I'm the director of sleep lab at American Hospital. So we have various kind of reasons why you might need a sleep study. Someone not sleeping very well, to someone snoring at night time, to someone being on home machine for breathing.
Right.
And sometimes these children might need tracheostomy and ventilation. So again, 1/3 of my job would involve doing sleep study, titrating the different pressures on the machine, helping them to breathe properly at night time.
Yeah, so this is probably why the American Hospital in Dubai is one of the best hospitals for your practice, isn't it? Because they've got a very comprehensive paediatric department, as well as ICU, PICU services in the hospital, isn't it?
Correct, absolutely. So I would say that in the private sector, we are the biggest in pediatrics.
Wow.
We have the whole subspecialty to support you.
Yes.
And when I had started, we were just 7 of us. Now we are a team of 50 plus.
Oh my gosh.
So we, outside the children's hospital, we are pretty much a mini children's hospital in ourselves.
Yeah.
So you need that support from the management to build the services, but then you need the support from your team because it's not a single-handed service.
Absolutely.
Many of these children, when they have complex problems, it's not just one organ getting involved. So you might need help from gastroenterologists to neurologists to intensive care, and we have all the right support with us. And I'm lucky that we
Yes.
have that, and we have a very, very good team.
Yeah, because I know it's very inspiring actually, because I know how difficult it is to find paediatric subspecialty doctors. Like, it's so difficult. So the fact
Yes.
that you've got this incredible team at the American Hospital, it's really inspiring actually what you've all achieved.
Yeah,
Yeah.
absolutely. Yeah, and I would say that we are lucky that we have the right team,
Yeah.
and it's also good for everyone in this part of the world that they don't have to travel abroad to get the right expertise. It's there at their doorsteps.
Exactly.
And I would say that pretty much it's rare now for us to send anyone abroad.
Wow.
I feel that there is nothing that we can't do in Dubai, and I have to say that you have to go abroad for this bit.
That is really inspiring. So what was it that made you decide to relocate to Dubai?
Right. Okay. That's a very good question. Actually, I wasn't looking actively to move to Dubai, but I was actively looking to move in a sunny country.
Right.
So, Dubai was one of the places.
Yeah.
I was thinking about we might relocate to Australia as well. But during COVID, I think one of my friend who was the head of pediatrics at American Hospital that time, she called me and I was driving to work and asking that, Omi, would you like to move to Dubai? And that came as a surprise. And I said that, call me when I'm driving back home because that's a 40-minute drive with getting stuck in traffic. And she explained to me that, the vision of hospital is that they want a mini children's hospital. And at the minute, we don't have any subspecialty except for me. She was a gastroenterologist.
Yeah.
And she said, but we want to build a service. So come here, set up the service and set up the intensive care as well. And that will be amazing. And that's how kind of it started. And I inquired a bit more and spoke to the family. And they said, why don't you go and explore it?
Yeah.
And I got a sabbatical from work. They were very, very supportive as well. And my parents are in India. I wanted to be a bit closer to them.
Yes.
So I thought, let's go and explore. If we like it, we stay. If we don't like it, we come back.
Yeah.
And I must say that it's no looking back really, because Dubai is an amazing place. Work is amazing. So it's been well.
Yeah,
It's
because India's only 3 hours away, isn't
3
it?
hours away,
Yeah. I think
correct?
sometimes you just pop over at the weekend and then you're
Correct.
back at work on Monday.
Exactly, and that's what I do. I
See
just
your
go for the
parents.
weekend, and parents feel nice. It's easier for them as well to come.
Yes.
So it's very, very easy actually. Yeah. So we are very happy as a family overall.
Perfect. How long would you say it took you to build up your patient base here in Dubai? And do you have any advice you could give to other specialist doctors in the region?
I would say that it took between 3 to 6 months
Okay.
to build my practice. And Dubai is a place where people go by recommendation,
Yes.
by word of mouth. And once you start doing good work, people want to come to you.
Exactly.
So, and I was lucky that I got few complex cases early on when I had started here, and they did really well. And then by word of mouth, it just kind of picked up very, very rapidly.
Yes.
And that way I was really lucky. But also I would say that you have to go out and about.
Yes.
People should know you, that you are here, because people are otherwise not aware. So, and how do people come across to know you? Like when you do few education things, you attend conferences, you're speaking there, you're active on social media, and that social media could be anything, but
Yeah.
something, your presence should be there online. And you do an amazing job. You bring out great doctors in Dubai, and so you have built up a good team of doctors over here doing these podcasts. People are aware, and that's what I would say, that any person who's new in UAE, they should go out, and meet people,
Yes.
introduce yourself, do conferences,
Yeah.
social media, online presence, podcasts, all these
Exactly.
things helps you.
Exactly. You are actually the director of the Children's Centre at the American Hospital in Dubai. Could you just tell us a bit more about your responsibilities, like your job role at the hospital?
Yeah, so I'm one of the directors, so we are three of us.
Okay.
And because, as I said, our team is very big, we are now 50 plus.
Wow.
So we have divided our roles. So, but primarily, I would say that role is in terms of operational. So, making sure that our day-to-day workload is fine. We have, in terms of the recruitment, do we have the right numbers? Are we getting any complaints? If we are getting the complaints, how do we sort it out? In terms of, do we need to improve the workforce? Do we need to improve the flow of the patient load? How can we improve? And apart from that, looking into the revenues, that are we getting enough? How can we keep expanding? And just so we are the middle tier of management, I would say. So reporting to the senior management in terms of board and looking after our colleagues. So that's our daily role as the director. And also I'm being the director of the sleep lab. So I need to make sure that, we have the right equipments, the waiting list is not huge, patients are not feeling supported,
Yeah.
your colleagues are feeling supported. So that's what, as a director, I would say is involves apart from my daily pulmonology job.
So, Omi, have you been able to get involved in research since you've been working here in Dubai?
Yes. So again, I've been lucky that we have a larger team who can, support in terms of, so at American Hospital, we have the ethics committee and research committee as well. And also we have been lucky that we are one of the centers where we have looked after some rarer conditions as well. So working with other hospitals, we have provided care for almost 150 children who have been given gene therapy as part of SMA, which is spinal muscular atrophy, which is quite a rare condition.
Right.
And we work along with other neurologists from other hospitals. And if they don't have the pulmonology service, they all come to us for their whole package in terms of doing their sleep study, getting the right support from the physiotherapist, speech therapist, which we provide. And we are, in fact, the largest center doing this, and as a single hospital in the world. And we have published our data with other teams. So I would say that there has been a multidisciplinary approach to these rarer cases, and we have published our data. So we have done a lot of research from that perspective. But if you ask me, do I get a dedicated time for research? Unfortunately, no, because we are very busy in
Yes.
terms of our clinical role. So that's another difference when doctors are moving from abroad. Some of the doctors would have dedicated time as part of research in UK,
Yeah.
but they might not be able to get it. But again, you can build up these services, and that's where Dubai is evolving.
Yes.
It's an evolving place that we might see in future, next 5 years, that we are doing cutting edge research. More papers are coming from this part of the world.
Yeah, that's really inspiring to hear that how the American Hospital is collaborating with other hospitals in
Yes.
Dubai, and it's successful.
Very, very successful.
Yeah,
Very good.
I love that. And how has your experience been with Allocation Assist?
So I would say that we have been friends for last few years, and you and your team are doing an excellent job. I have been involved in the WhatsApp group which you have, which is, I think, tremendous help for any new doctor when they don't know where to refer, whom to ask for, right from not only their specialities, but also like common things in terms of where can we get this fixed, where can we buy a car, to from social aspects. And your social events that you have been doing every few months is amazing, because the networking events, these people come across, meet, and I think that helps not only as to get established in Dubai, but also as a good platform for referral. And because we all have our families over here, we not only we want to provide this service to our patients, but also sometimes we need help.
Yes.
And if you know the right doctors and they're top notch in their field, it really helps. And you're doing an amazing job in that. Well done, Emily.
Oh, thank you so much. Thank you, Ami.